If you're just getting started with hearing aids, here's what you need to know. Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona, and in this video, I'm sharing the 5 things that you need to know to guarantee your success with hearing aids as a new hearing aid user. Chances are, if you're watching this video, you're someone who's noticed that you have hearing loss, or you've been tested and you've been told you have hearing loss and you've been given a recommendation for hearing aids, or you actually have hearing aids for the first time, or perhaps you're someone who doesn't have hearing loss yourself, but you know somebody else who does. No matter where you are in your hearing loss treatment journey, the information I'm going to be sharing with you in this video could be the difference between you loving your hearing aids and you absolutely hating your hearing aids. Let's be honest with each other for a second here. Everybody knows somebody else who feels like they wasted money on a pair of hearing aids that just don't work very well. Unfortunately, this is very common, but it's not usually the fault of the hearing aids. If we're looking to cast blame, it's usually a combination of the fault between the hearing care professional and yourself. And you'll see why after I explain the 5 things that can make or break your success with hearing aids as a new user. But before I do me a huge favor, click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It's greatly appreciated. And let me know down in the comment section where you're at in your hearing loss treatment journey. All right, so the first thing that you need to know if you're just getting started with hearing aids is that the evaluation matters. The best hearing aid clinics usually schedule longer consultation times to make sure that they have enough time to identify your wants, needs, and values, as well as evaluate your hearing loss with a comprehensive hearing test. These longer evaluations are not typically free, but they are absolutely priceless because they give your hearing care professional a full understanding of your auditory system. If your hearing care professional isn't spending a minimum of 90 minutes on your initial consultation, chances are they're just not spending enough time with you to get the full picture of your hearing loss. When it comes to the hearing test portion of this consultation, they should be performing a comprehensive hearing evaluation that includes pure tone, air, and bone conduction testing, recorded speech testing, speech and noise testing, and identifying your uncomfortably loud levels. If they do not obtain your scores on each one of these very specific tests inside of a comprehensive hearing evaluation, then they will not be able to make the most accurate treatment recommendation for you. And once your evaluation is completed, they should be spending enough time with you to make sure that you completely understand the results of your hearing test and help you understand if hearing aids are actually your best treatment option. Ultimately, your initial consultation and evaluation appointment should end in a recommendation for either a medical referral, hearing aids, a cochlear implant evaluation, or an alternative treatment option. Unless, of course, they do not find any hearing loss and just give you a recommendation for an additional hearing test at some point down the road. If you feel like your initial consultation and evaluation had none of the things that I just got done explaining, then you probably need to find another place for a second opinion. The second thing that you need to know if you're just getting started with hearing aids is that the programming is substantially more important than the hearing aids themselves. Now, don't get me wrong, having good hearing aids is important, but it's nowhere even close to as important as how well those hearing aids are fit and programmed by your hearing care professional. This is why I'm not usually a fan of the hearing aid trial at your initial consultation. A hearing aid trial is often completed using a pair of demo hearing aids that a clinic just has on their shelves, and those hearing aids might not be the best hearing aids for you. On top of that, the hearing care professional usually does not have time to custom program those devices using real ear measurement. So the hearing aids that you're actually going to be going through the trial with have not even been set up to give you a full understanding of what your hearing potential is. And I don't know about you, but I don't like to make a decision on anything unless I have as accurate of information as humanly possible. So ideally, your hearing care professional should be giving you a very specific recommendation on a hearing aid and then having you come back at some point in the future to make sure that they fit and program those hearing aids on you following comprehensive audiologic best practices. Now, just so we're clear, these best practices are a long series of procedures that must be completed by your hearing care professional in order to maximize your performance with any hearing aids that you use. This includes test box measures to ensure that the hearing aids they fit you with are meeting manufacturer specifications, real ear measurement to verify that the amount of amplification you're receiving from your hearing aids matches your hearing loss prescription that is calculated using your audiogram, validation outcome measures that identifies your subjective hearing improvement with your hearing aids, and and training to ensure that you understand how to use, manipulate, and maintain your own devices properly. If these best practices are not completed prior to and during your initial hearing aid fitting, then you're basically just setting yourself up for disappointment. Now you might be thinking, hey Dr. Cliff, that's great, but where do I find one of these magical hearing care professionals that does all of these best practice procedures that you just talked about? Well, it's actually super simple. All you need to do is go to my website, HearingUp.com, and find a HearingUp network member in your area. All HearingUp members have been vetted and are committed to following comprehensive audiologic best practices to ensure that you receive the maximum amount of benefit from your hearing aids. So if you're new to hearing aid treatment and you want to make sure that you receive the proper guidance and support, finding a HearingUp network member in your area is your best bet. The third thing you need to know if you're just getting started with hearing aids is that the hearing aid technology matters. Yeah, I know I just got done telling you that the fit and programming of your hearing aids is substantially more important than the technology itself, but the technology still matters. You need to make sure that the hearing aids that were recommended to you are the best option when it comes to the physical fit, the level of customization, and the available features. The receiver and canal style of hearing aid is by far the most popular hearing aid out there. And that's fine, but your hearing care professional still needs to make sure that they select the appropriate dome or custom ear mold for the size and shape of your ear, as well as your configuration of hearing loss. In my opinion, rubber domes are way over recommended in the world of hearing care, and a lot of people would get substantially more benefit using a custom ear mold. Regardless, whether you go with a rubber dome or a custom ear mold, you have to make sure that they fit your ears comfortably and that they're capable of amplifying sound to your prescriptive levels that are verified using real ear measurement. Now, when it comes to the level of customization and available features inside of a hearing aid, it has a lot to do with the brand of hearing aids that you go with and the technology level of those hearing aids. As a new hearing aid user, you may not be aware that most hearing aid clinics only offer one brand of hearing aids consistently. But what if that one brand isn't the right brand for you based on the customizations and features? This is why you always need to make sure that when you go to a hearing aid clinic, they offer at least 2 or more brands that they can fit you with. This way you don't get pigeonholed into devices that aren't actually right for you. On top of that, all major prescription hearing aid brands have multiple tiers of technology. You can have top tier, second tier, third tier, sometimes even fourth and fifth tier. Now, each time that you drop down in technology level, it takes features and customizations away from your hearing care professional when they're trying to optimize those devices for you. Now, each time that you drop down in technology level, it does not guarantee that you'll lose performance, but it does mean that there's the potential that you'll be leaving some benefit on the table. Of course, it also saves you money each time you drop down in technology level. So my recommendation is usually the same for everybody. You should be going with the highest level of technology you can reasonably afford, and if you cannot afford it, you should be dropping down to whatever level you can afford, and then it's the job of your hearing care professional to maximize the performance of those devices for you. And if you remember nothing else from this video, remember this: never buy locked hearing aids. Now, when I use the term locked, it basically means that you can only have those hearing aids programmed by the clinic that you purchased them from or any of their other franchise locations. What this means is that if you're not having success with your hearing aids at the clinic that you purchased them from, you can't just take them to a different clinic and have them go in and reprogram them for you. A good rule of thumb to prevent yourself from accidentally purchasing a pair of locked hearing aids, you'll want to go with hearing aid brands like Phonak, Oticon, Starkey, Signia, Widex, Unitron, or even Resound, just to make sure. If it's not one of those 7 hearing aids, I would proceed with caution. The fourth thing that you need to know if you're just getting started with hearing aids is that adaptation and adjustments will be required. It takes the human brain approximately 30 days to adapt to any new hearing aid treatment. This means that you will not even know how much benefit you will ultimately receive from your hearing aids until you've been wearing them consistently for around a month. Throughout this time, your hearing care professional should be able to identify different areas of your treatment that they can improve with different programming and feature enhancements. If you report at your first follow-up visit that everything is going great, they should be digging even harder to find other areas that they can improve in your overall treatment. After all, that's what you're paying them for. After 30 to 45 days of you wearing your hearing aids and coming back for follow-up visits with your hearing care professional, they should be performing the other half of your validation outcome measure to ensure that you're receiving a significant subjective perceived improvement with those devices. A hearing care professional simply asking you how you feel like you're doing with your hearing aids is not a validated way for them to identify if you're actually getting significant improvement. Now, it's important to understand that once you're done with your initial 30 to 45 days of adaptation with your hearing aids and things are going pretty well, the work is not over. You should be scheduling regular follow-up visits with your hearing care professional every 3 to 6 months to ensure that they're staying on top of preventative maintenance so they can remove earwax from your ears and so they can do additional programming adjustments on your devices. After 12 to 18 months have gone by, it's usually ideal to get another hearing test completed so they can see if there's any progression in your hearing loss. And if there is, they need to go back in and re-verify the programming to make sure that you're still able to hear your absolute best. Essentially, from now until forever, it is a never-ending battle between your hearing care professional and your hearing loss. It is your hearing care professional's responsibility to stay on top of your hearing loss. And as long as you keep going back in for your recommended follow-up visits, they'll be able to make sure that they have your hearing loss successfully treated for years to come. And there you go. Those are the 5 things that you need to know if you're new to hearing aids. High-level hearing aid treatment is complex and extremely detail-oriented. So if you're new to hearing aids, it's very important that you at least do some research on your own so you can know what to expect and make sure that you find a hearing care professional who is excellent at what they do. And if you keep these 5 things in mind, it significantly increases the likelihood that you'll be extremely successful with your new hearing aids.